Hello and welcome to the programme. We start with the breakthrough by a London medical team which could revolutionise heart surgery. It could also be a stepping stone to more astonishing developments in medicine. Dr. Chris Mason and colleagues at University College London have found a way of reproducing blood vessels for coronary bypass operations. And that paves the way for the mass production of human organs. Our health correspondent Liz Wickham has this report.
Long nights in an underground lab just to find enough space to do his amazing work. Dr. Frankenstein would be in awe of the man who can make real body parts from a few of the patient's cells. No nuts, no bolts, no use of animals, just genius.
The idea is that we take some cells from you, the patient, and mix it with a polymer, simple polymer, mix them up and inject them through this part here, straight into the device. And using the device, we then make a tube with cells in it, which is your cells, and then flow a growth medium around the circuit for about 6 weeks until we actually have a blood vessel.
The blood vessel would be completely enclosed in this mould until the surgeon needed to take it out in the operating theatre. It would be perfect for a heart bypass op. Currently a vein has to be stripped out of the patient's leg and it makes a very poor substitute.
Artery has a very muscular wall, and that is what we're going to create in this device. And it's been shown that patients who have arterial grafts as opposed to vein ones do far, far better.
He can make valves too, and skin. Eventually he should be able to mould anything. The method is adaptable to a production line and would be relatively cheap. It's won Chris first prize in the Medical Innovations Awards, a new competition to support people who struggle away in the NHS and whose brilliant ideas will disappear without financial support.
Well, it's obviously fabulous, and it's something I've dreamed of, and it really will help my research and maybe getting the project off the ground in the long term.
In Borough, this is Liz Wickham for London Today.
What amazing stuff that is. And the man shaking hands with Dr. Mason at the end of that report was Dr. Andy Goldberg, the founder of the Medical Innovations Awards, and he's here with me now. Now, Dr. Goldberg, Dr. Mason's work applied, as we saw, to blood vessels, but it can eventually, you hope, apply to organs as well, developing organs. Absolutely.
I mean, as an ageing population and the ages increase and people live longer, there's going to be an increased requirement for extra organs that are failing. Kidneys, skin, heart, liver.
How long away?